I want to welcome you to this the video in the series for dispensing for the Lions in Sight missions. To introduce myself, I'm Dr. Karina Vanderpool, or as I'm known in Mexico, Doctora. And I'm going to be talking to you a little bit in this video about optics and refractive error. It's helpful if you understand what it is a patient has. So you as the dispensers, your role, give them the right pair of glasses, get that big smile, and feel really good about yourself. So what is refractive error? Well, refractive error means that there's an error, that things are not quite matched up. And you have where the eye and the length of the eye and the power of the lens and so forth are not exactly right, so that the light that comes into the eye focuses on the retina. With that, if you take a look at the anatomy of the eye, what you see is you see the cornea, which is the front portion of the eye. That's the clear portion of the eye that you see. Then you see a lens inside the eye, and as you progress into the eye, it goes to the retina. And the light that comes into the eye comes through the cornea, it's focused a little bit, goes into the lens, it's focused a little bit more, and finally lands at the retina. And if all of those things work well together, then you get a nice clear image, which is a condition that we call emmetropia, normal vision. So the power of the eye and the length of the eye are exactly correct, so that as the light rays pass through the cornea and the lens, they come into a nice focus on the retina. What we really want to talk about here, though, are the various categories of refractive error. So again, when the eyes are not exactly proper in terms of power or length, then you get refractive errors such as myopia, commonly known as nearsightedness, hyperopia, known as farsightedness, and astigmatism. So the first refractive error that we're going to talk about is myopia. The picture that you see here is actually one of Lions Club members who has myopia, and the reason you can tell that he has myopia is that if you take a look at his eyes, they actually look small behind the eye lenses. So a person who has myopia is nearsighted, they end up needing minus glasses, and the minus glasses make things smaller. A person who has myopia is nearsighted, they end up needing minus glasses, and the minus glasses make things smaller. In myopia, you have, optics-wise, you have an eye that is either too long, or the lens and the cornea inside the eye are too strong. And so the light coming in the cornea and the lens just doesn't come to focus on the retina. So the power of the eye is too strong. If you take a look at what somebody with myopia might see, they're going to see things better up close than they see far away. So hence the name of the condition is nearsightedness. So poor distance vision and eye strain are typical symptoms of myopia. How do you correct myopia? Again, I alluded to this. It's a minus lens, and these lenses are typically, we call negative power. Just the side shape of the lens, they tend to be thin in the center and kind of thick at the edge. And if you look at objects through the lens, the object looks smaller when you look through the lens. They're minified. Basically what's happening is the light rays that come into that lens are being diverged instead of converged to decrease the power, so that when it hits that very strong eye, it'll come into focus on the retina. An example prescription for myopia, typically you're going to see minus prescription. OD is right eye, and OS is left eye. And so in this prescription, we have an OD power of minus 3.25 for the right eye. It's sphere, that means it's just a single power, and minus 2.75 diopter sphere for the left eye. For hyperopia, we have the opposite problem. Hyperopia, the eye is actually too short or too weak to bring the light into focus on the retina. And if you look at somebody who has hyperopia, you look at their glasses, you'll actually notice that their eyes look bigger behind the lenses. So in hyperopia, in terms of optics, what's going on? The eye is too short, the power of the eye is too weak, and as the light comes in, it just cannot come into focus by the time it gets to the retina, so you have an out-of-focus image. Patients with hyperopia, they tend to see objects in the distance clearly, although they have to force their eyes a little bit to see those objects in the distance, and then objects up close tend to be out of focus. So a patient with hyperopia, what's happening is, again, the eye is too short or the optics of the cornea and the lens are not strong enough. So light coming in, it just plain old doesn't come into focus in time for the retina. So if you're a young patient, so under age 40, you can actually accommodate that lens inside the eye will actually change its shape a little bit of focusing, like an autofocus on a camera, and you can force the light rays to come into focus on the retina. So how do you correct hyperopia? So with the myopia, we use negative lenses. With hyperopia, we use positive or plus lenses. And the lenses tend to be thick in the center and thin at the edge, kind of like what you might use when you're, with a magnifying glass and you're trying to burn an ant. And objects that are seen through the lenses are magnified. So the light rays coming in, now instead of diverging when they come through the lens, they actually converge. They're changing their focus to get to the retina. So putting a plus lens in front of a hyperopic eye, you can bring the light rays into focus at the retina. A typical prescription for somebody who has hyperopia, now you're going to see on the prescription, you're going to see plus signs. So for the right eye, we have an example prescription here of plus 3.25 sphere. Again, it's a single power. And for the left eye, or OS, we have plus 2.75 diopter sphere. And basically this means that the right eye needs a little bit more power than the left eye, a little bit more plus power than the left eye. Which brings us now to the third refractive error, which is astigmatism. A little bit more difficult to describe, so I'm going to start off with my little prop here. So I've got a little Kinder Egg from Holland. And so if the cornea of the eye, the front of the eye, is shaped very round, let's say like the bottom of the egg, then the light coming in will come into a nice, clear, and single focus. If you look at the side of the egg, now you have a very sort of flat curvature one direction and a very steep curvature the other direction. And now what happens, the light that's being focused by this part of the cornea is not being focused as much as the light that's being focused by this part. And so you end up with a sort of an extended or stretched image on the retina when it's shaped a little bit more like an egg or a football. So astigmatism, we typically describe it, the cornea is shaped like an American football, like the side of the football, kind of long, a flat curve one direction and steep curve the other direction. And now instead of getting a single focus or a single point, you get two foci, we'll say one that's this like this and one that's like this, and what happens is it's really distorted or stretched when it reaches the retina. So typically a patient who has astigmatism will complain of blurry vision both at distance and near. So my vision is blurry for far and near. And it tends to be a little bit of a distorted vision. Things are just sort of stretched, and they'll often have headaches because they tend to squint their eyes to clear things up. And tired eyes is also a typical symptom. Another image here of astigmatism, which also shows that you can see on the lines of the tower that there's a stretching that's occurring, and so instead of nice even lines, there's a bit of a stretching both up and down. So how do you correct astigmatism? I can't just give them a myopia pair of glasses or a hyperopia pair of glasses. I actually have to give them glasses that take the powers and basically correct for the fact that there's not enough power this way or there's too much power this way. And so you have to have a lens that adds power this way or takes away power this way so that you get a clear focus. So cylinder lenses, you'll hear things like these are glasses for astigmatism or they're cylinder lenses. They're very specific to the patient and they have to be tailored to the patient, because one other thing that's true is that I showed you astigmatism with a flat curve this way and a sharp curve this way. Patients' eyes can have the curvature this direction, or it could be this direction. It can be sharper or more steep this direction and flatter this direction on the cornea. It does not have to be one particular direction. So basically we have 180 degrees of possible direction for the correction of astigmatism based on that fact. So showing an example for astigmatism here, this example shows a -1 sphere. That means the patient has myopia, it's minus. There's a -1 cylinder, that's how much astigmatism they have, and then there's an axis of 180. Now, So that's the direction, horizontal this way. If you see 90, it would be axis vertical. So an example prescription, we have, in this example, I've got for the right eye a plus 3.25 sphere. Now this is a hyperopia, so it's plus, first number tells you hyperopia, minus 0.75, the amount of astigmatism, and axis 180 horizontal. For the left eye, plus 2.75, so still hyperopia, a little bit less than the right eye, minus 150 astigmatism, so slightly higher amount of astigmatism, and axis 170. Now, instead of being exactly horizontal, it's about 10 degrees off from horizontal. So the patient needs this very specific orientation to the correction. In this example of myopic astigmatism, now we see minus signs for the sphere. Same amount of astigmatism, but now the axis is 90 in the case of the right eye and 85 in the case of the left eye. So the orientation is different. The final condition is actually not a refractive error, it's a consequence of aging. It's called presbyopia, presby meaning old and opia meaning eye. And the little bear sitting here is suffering from presbyopia, so we fit him with a pair of bifocals, and he's much happier, as you can see. So in the optics of presbyopia, essentially what happens is once you get beyond the age of 40, the lens inside your eye no longer has the ability to change shape to basically autofocus or bring things into focus as you look from far to near. So as it gets denser, as it gets less elastic, now you're no longer able to change your focus from seeing far to looking up close, and patients will complain that their arms are not long enough. So what is presbyopia? It generally starts around age 30 to 40, but patients don't really get the problems associated with presbyopia. They don't really get problems till they're probably around age 40 or so. It's a natural part of aging. So if you're lucky enough to live past age 40, you will experience presbyopia. And then after age 40, it just sort of gradually gets a little bit worse. The lens becomes a little bit more stiff, and you need more power in order to see up close. So as you age, as shown in this chart, essentially a 40-year-old would need around +1 diopter of more power to see close. When you get around age 50, it's +2. When it's around age 60, it's +250. And that varies from area of the world to area of the world, and certainly varies with the length of the patient's arms. So here's an example prescription for bifocals. We have very similar prescription to what we were showing before for astigmatism. We have minus powers, which tells you that they're myopia with astigmatism and a particular axis, different for the right eye than the left eye. But the thing that's very different and new is the very bottom power that you see that says add, ADD, that's the addition of +2.50. So looking at this, I could say the patient is myopic, they have astigmatism, and with a +250 add, possibly they're around age 60. This example is one that's a simple hyperopia, +350 and a +250 in terms of powers, and an add power +150. So this patient, hyperopic, probably around age 45 or so. And the final prescription is right eye +2 and left eye +2. And you might say, that looks like a hyperopia prescription. Well, kind of. It's the same sort of idea, your plus power, but this is for somebody who just needs the glasses for near. So they have emetropia, they see well far away, they've lived beyond the age of 40, now they need more add power to see up close, but they don't need anything to see far away, so they just need what we call readers. And how common are these conditions? Well, if you take the world as a whole, having hyperopia, myopia, or presbyopia or astigmatism is actually a small percentage. But if you think about a clinic where patients come to get care, you're going to see a lot of presbyopes. So in the chart that I'm showing, I've got about 65% of the patients that come in are going to be presbyopes. So they need something to see near, but they also may need something to see far away. So those patients would need bifocals. About 10% of patients are going to have astigmatism. About 10% are going to be myopic, and about 15% are going to have just plain hyperopia without presbyopia. And this is sort of typical numbers for a Mexico clinic. If you go someplace else, you go to India, you're going to see more myopia. You go to Africa, potentially you'll see more myopia as well. So it varies by the part of the world that you're going. So with that, let's do a little test of your knowledge. The choices here, you're looking at a patient who has astigmatism, and your question is, what will a person with astigmatism complain of? Will they complain of blurry vision at distance, blurry vision at near, distorted vision, eye strain, eye pressure, or all of the above? I'll give you a moment to think about that. And it is all of the above. This is an example of a prescription. I've got a plus 175 for the right eye and a plus 175 sphere for the left eye. Is it a presbyopia correction, a myopia correction, an astigmatism correction, or a hyperopia correction? And again, just think about that. Plus power lenses. Actually, it could be a correction for presbyopia as readers, and it also is a correction for hyperopia. So plus classes are for both of these conditions. Here's George Burns. A few of you may remember George Burns, and he's wearing a pair of glasses. Take a good look at his eyes and tell me, what kind of glasses do you think George Burns is wearing? The eyes look a little bigger, a little enlarged. Are they minified or magnified? Magnified. So these are plus lenses, and George Burns had hyperopia, and he was farsighted. Lenses to correct myopia are described as cylinder lenses, plus lenses, minus lenses, or reading lenses? And again, think about it. Myopia starts with the letter M. Possibly it's minus lenses. So if you got through all of that quiz and got a little bit better understanding of the optics and refractive error and the kind of patient conditions that you might see, then you're going to be a happy dispenser, and hopefully you'll have a bunch of happy patients as well.